Have you ever wondered that you're having malaria symptom, but the test result comes out negative? I'm going to mention 3 reasons why this happens. Number one, it might be an early infection, because if you get bitten by a mosquito, you don't just get infected, like you don't start feeling malaria symptom. It takes a while, incubation period, window period, before it start manifesting in your red blood cell. Number two, you use drugs before testing. Some of you take malaria drugs to subdue the symptom before you go to the laboratory to test. I mean, how would you expect the result to come out positive? It will definitely come out negative if the symptom you're having is actually malaria related, like it's actually malaria that caused those symptoms. The malaria drugs you have taken before going to the laboratory have subdued it, so there is no way it will reflect in your test result anymore. And lastly, number three, it's another illness that is mimicking malaria. You see stomach ache, headache, fever, joint pain, body ache. You see all these symptoms I just mentioned. All of them can happen in every other illness. So you should not say if you're having these symptoms is applied to malaria alone. You might be having these symptoms and you're suffering from something else and not necessarily malaria, which is why it is important that if you have any symptom, run to the laboratory and run diagnosis to be sure of whatever you are treating. Because a lot of you have abused malaria drugs at every point of headache, fever, stomach ache, joint pain, whatever. It is blamed on malaria. Probably you might not even have the malaria and you just start taking malaria drugs. And guess what, darling? By the time your body gets used to these medications, there is no malaria drug you will take that will eradicate malaria for you again, because your body has formed resistance to these medications. I'm not even talking about your liver. If you need more clarity, drop your questions in the comments. And don't forget to like, share, and follow for more.